Welcome to SkinCast, the podcast where we dive deep into the world of aesthetics. SkinCast is proudly brought to you by Ceraderm, a leading distributor of advanced aesthetic solutions. At Ceraderm, we're committed to empowering aesthetic professionals with the tools and knowledge they need for a successful practice. Each episode will bring you expert interviews, success stories, and practical guidance to help you maximize your ROI, achieve the best clinical outcomes, and keep you informed about the latest innovations. So sit back, relax, and get ready to unlock your practice with SkinCast.
Hi everyone, and welcome to our newest episode of SkinCast. And I'm delighted to be here with the wonderful Dr. Holly and Dr. Toni from Fitzrovia Clinic, who I count as good friends of mine.
Thanks so much for inviting us on, Kevin.
So today we're going to be talking about melasma. So I guess the first question is, tell us a little bit about melasma. What is melasma?
So, simply put, melasma is a disorder of pigmentation, and it is notoriously tricky to treat, and we tend to see quite a lot of it in our clinics. So we know that it affects around 10 to 30% of women. Males are affected, but much less so. So usually around 2 to 5% of males are likely to present with melasma, and it has very strong genetic and hormonal influencing factors. So yeah.
And do you get a lot of people asking for the treatment of melasma in the clinic?
The majority of our patients are female, and I would say per week I would see at least 2 patients come through with melasma, and the fact that we're treating more of it these days means I actually see more of it. So yes.
And I know from my laser background, it's quite tricky to treat. Why is it tricky to treat?
So the problem with melasma is that you have these melanocytes, the pigment producing cells that sit at the junction between the epidermis and the dermis. And in melasma they are hypersensitive. So due to genetic, hormonal drivers and then environmental factors, they are overproducing melanin. This is why we see this symmetrical bilateral patchy pigment. And a lot of our traditional approaches for treating pigmentation in the skin would involve the use of high energy heat. And in melasma, if you do that to the melanocyte, it's going to get very angry and it's going to continue to produce more pigmentation.
I know we often get sent photographs where people have misdiagnosed melasma, treated them with inappropriate equipment, and it's got worse. So I guess, in your experience then, what would be the treatment options?
Well, within our clinic, the main options that we used to have would have been going towards skincare. I thought we should just add in actually so people can recognise what melasma is, because you said people sometimes confuse it. So melasma tends to be quite centrofacial, and it tends to affect certain areas such as the forehead, the temples, upper part of the cheek, sparing around the orbit. And it's quite well demarcated. So it is, once you recognise it, it's quite obvious. Going back to treatment options, so some patients may think, being pigmentation, that you can use options such as a CO2 laser or IPL, but the problem is that these devices can be quite aggressive and produce quite a lot of heat, and this is one of the contributing factors to worsening melasma. So we tend to, within our clinic, stick towards methods such as LaseMD Ultra, which is a phenomenal device for us, and also various skincare options. There are other things that we can contribute within those treatment options, but that's been probably the mainstay for most patients.
Well, I know for me LaseMD is exciting. It's a new generation of lasers. So perhaps you could tell us a little bit more about how LaseMD Ultra works.
So the LaseMD, it's a thulium laser with a 1927 nanometer wavelength, and it targets just beneath the surface of the skin. So it spares the surface of the skin, so the downtime is quite minimal, and creates these little sort of micro channels. And the benefit of that is that it, alongside the actual laser, you get these ampules, and so we can then infuse products to get a combined effect of both the sort of remodeling of the tissue itself, but also then you've got products such as tranexamic acid, which also produce an effect. So this combined effort then improves the results of the melasma.
So it's a great way of combination therapy then, could be able to combine cosmeceuticals with the laser. And I guess perhaps carrying on a bit from that, it's increasing the penetration of that product then?
Yeah, so essentially, because it's a fractionated sub-ablative laser. So fractionated means that it's leaving or sparing some little zones of skin around the treatment zones. And because it's a water-absorbed laser, it bypasses predominantly the very, very superficial part of the epidermis, the stratum corneum, which is relatively dry. And then it creates these little kind of reservoirs just under the surface, which act as pockets or channels, so that when we apply topicals to the surface, the topicals can penetrate down into the skin, bypassing the issues that we have with skin barrier function that normally impair this. And this then infuses the products further down, which means that we can actually get them to the cells that require them.
So one of the questions that would come to mind, this is a water-absorbing laser. So if it's a water-absorbing laser, how does it work for pigmentation?
Yeah, you're absolutely right. So the chromophore is water for the thulium laser, and it creates these vacuoles, as you mentioned. And when it does this, you get some sort of shedding of the skin. So the patient will see some early signs of improvement in pigmentation, but also you then get remodeling of the dermis. So the melanocytes themselves start to be better regulated. But in addition, because you have these little tiny channels that are being created, the absorption of the products as well, all combined, then help to improve the melasma.
So it's a combination of
all those factors.
Of all those things.
Yeah.
So you are literally, if we think about melasma, the vast majority of the pigmentation is within the epidermis. So if you vaporize a proportion of the epidermis, then you are going to remove some of that pigmentation just by default. But actually, the difference with this treatment and why it is so effective in treating melasma is that in melasma you tend to have some dysfunction around the basement membrane, some sort of leakiness, lack of robustness. And because as a water-absorbed laser, you're getting that inflammation and then the remodeling of the cells and tissue in that area, it's that basement membrane remodeling that also contributes to the result.
Excellent. I guess you said interested with vaporization there, so people will be thinking, wow, what's the downtime?
And there's hardly any downtime. So for the majority of patients, they'll be red for about 24 hours. Following on from that, they will have some sandpaper textured skin, which lasts roughly 4 days, but it doesn't stop them from going to work. I tend to advise just applying some moisturizer so they feel less dry and just protecting their skin. But in comparison to treatments such as the CO2 laser, it gives excellent results with very little downtime.
So I guess what would be the benefit of me buying, having a LaseMD Ultra? Would I just be able to do it just with tranexamic acid?
So I mean, our view on the Ultra, we use it for just about any skin that you can think of. Now, we treat a lot of melasma, so by default we use it a lot for melasma, but actually as a skin rejuvenation treatment and a general depigmenting laser, absolutely fantastic. So you have a range of different options of these cosmeceuticals that are available for use with the Ultra. Tranexamic acid, which is a vascular modifying agent, is probably the most appropriate for use with melasma. It also has a relatively low irritation rate with patients as well, but obviously you have other options for different skin concerns.
So I guess what it's doing is it's reducing the number of treatments required then, if you combine it with the product with Ultra?
You would assume so. I'm yet to be shown, studies that prove that, but we do know that tranexamic acid is very valuable in the treatment of melasma. So
I think we need to bear in mind that melasma, because it's a chronic condition, you're always going to need to consider that you'll be retreating it. And we've treated quite a lot of patients now, and there's always going to be that sort of they've completed a course, the skin looks amazing, and you need some hand-holding then to say, to make sure they're still using the right skincare to maintain the results, and they may need future treatments. So it's an ongoing process.
So typically, if someone comes in with melasma, how many treatments do you offer on the course of treatment then? Or?
So we do a course of 3 treatments quite close together, and then we have treatments just slightly further apart. So the first 3 treatments will be about, say, 2 to 4 weeks apart approximately. Then it'll be a month apart, 3 months after that, then a 6-month treatment as well. And throughout that, we'll be really carefully looking at their skincare and how they're protecting their skin throughout all of this to sort of reduce that those environmental factors that could be affecting it.
And can you use it on all skin types?
It's phenomenally so. It's all skin types and also even with a tan, so all year round.
Oh wow, perfect system then.
What's even better is it's the cost of treatment, because there's very few consumables. So, you know, a cost factor for a clinic compared to other treatments that we do is quite affordable.
I guess from a business perspective, you know, when people are watching this, there's a cost associated to purchasing a laser like that. So return on investment is important. I know people have looked at pico lasers in the past, but the return on investment must be difficult because they were such a big cost. What do you find about the return on investment with the LaseMD Ultra?
I think Toni would agree with me. We have a number of devices, and this has been our best device for return on investment. It's the one that's running almost continuously in the clinic, and because you can literally treat anyone all year round, with minimal downtime and fantastic results. It's really been awesome for us.
And is it a treatment that you could safely delegate to one of your perhaps nurses?
We do.
Oh, you do
Yes.
delegate to
Yeah, we have
we do that already.
skin therapist,
'Cause I think-
and we do delegate the treatments. We do tend to, because, you know, we're medical led, we'll tend to take responsibility for the diagnosis of the patient, make sure that the treatment is appropriate, but in terms of the actual delivery of the treatment, it's super quick and easy, and can very easily be performed by anyone who's trained and qualified to do so.
Well, look, brilliant. I think we're running out of time today, so thank you very much for coming in. I know we've got some further exciting episodes that we're going to be talking about. And one of the things I'm looking forward to is when we start to talk about combination therapy. I know you've made some great videos for my site in the past, and we look forward to seeing you again.
Brilliant.
Thanks, Kevin.
Thank you all for listening.